thank you very much for this space that we have to talk a little bit about us. It's quite like strange to talk about us, but I think that's nice also to share with others, because I think it's a journey that we need to be together. That's what for me breastfeeding has been for the last years, like having this opportunity to speak with others, things that initially it was really difficult to speak to anyone. Like it was like the crazy person talking about something that nobody really cared. And I felt like, why are people not caring about this, which is the most important thing in the world that nobody sees but me. So I really felt like very, very like isolated, and my journey, a bit about how I got into the field. I was a common pediatrician, maybe not as common, because one of the topics that I choose in the university as a topic that I don't know how to say that you could choose. I forgot how to say it in English, but it was about neuropsychoendocrinology. So it was a topic very interesting about this like holistic way to see the body and holistic way to learn, like to understand health and disease. And I was like in the second year of the university. So I was really, really young, maybe 19 or 20 years. And I thought that was one of the things that I wanted in my life. So this way to feel that an holistic view of medicine has always been with me. It's not something, and then breastfeeding came to put everything together. Like it was like the place where I needed to be, or the topic that I wanted to learn about. So I did my career in the university, a very big university. And then being a pediatrician was like, I don't know, I think I have always loved mammals and animals in general and instinctive things. And then I think that being a pediatrician was another thing that came into to feel those things that I really liked about people, about humans. And during my specialty, I did it in a very big hospital, a very tough hospital. It was like a third level. It means that you see like these difficult cases that came from all over the country. In Mexico, we have this centralized medicine in Mexico City, which makes it really difficult. I think that now it's a bit different, and we have different hospitals around the country. But a lot of the medicine, a lot of the third level is in Mexico City. So this hospital was that kind of hospital that brought like these cases from all around. And so I learned a lot about cancer, a lot about gastroenterology, hepatic things, these diseases that I have never seen anymore in my life. And I didn't learn much about human babies and normal and relations in between the mom and the baby. But I think that I always liked that. And I always wanted to, I don't know, to treat patients like not just a baby, but also with a mom. And that's what being a pediatrician gave me, like not to be just focused on one little thing of an adult, but being focused on this system that means to be a family. So at the end, I really liked the career. I really loved the being a pediatrician. And then I worked 1 year outside. I worked with sports children in a center it was very new in Mexico. That was a center of high achievement sports in Mexico. And it was weird because it was a very big place with a lot of children that live there, like training for Olympics and things like that. And I was like the first pediatrician that was there. There were many children and they never had a pediatrician before. So I was working with psychologists of the sport and with trainers and things like that, which are really, really nice. But I didn't felt like I was doing what I really enjoyed. And at the end, I always loved respiratory medicine. So I started a super specialty in respiratory medicine. And I got pregnant 2009. And then the pandemic hit, a influenza pandemic, which started in Mexico. And then I was pregnant around 4 months of pregnancy when that started. So I went to my house without being able to join again the hospital. And I was like, I didn't like from the beginning of my career, I never stopped. And then suddenly I stopped. And it was like against the wall, like against many, many things, like personal things. I think that there were a lot of gender things that they didn't know how to solve for me. I was like in the middle, being a resident and the influenza and first pregnancy, and my profession was going to, I was not able to come back. They told me you cannot come back until this ends because you're pregnant. And I felt like really, like again, like really bad. And it was so difficult to be at home without doing anything. My private practice was really starting, so it was really difficult. And then I started to read about breastfeeding, and then what's gonna come, a baby's gonna come, what do I need to know, motherhood, babies, breastfeeding, and then suddenly a world, like if I started to read, I felt like when I started studying medicine, what is this that nobody have taught me before? Why didn't they teach me about this? That it's so amazing. And I started to read about being an IBCLC and all the information and physiology and endocrinology and everything again that I really enjoyed in medicine school. Again, like related to breastfeeding. And it was for me like a changing moment of my life. So my child was born. She was a C-section after an induction, all of that kind of things that you live, that now when you know more things, you say, why aren't we with healthcare professionals that really support moms with that kind of things? I wanted a vaginal delivery. I wanted like everything to be very like natural, and things weren't like that. And now because of that surrounding, of that lack of support, it was really difficult. And even though my second baby that was born after a vaginal delivery with the same gynecologist, the same pediatrician, but I told them, that what I do in my life now, I want this to be a mammal delivery, and I want to share with you. So my gynecologist told me, just because it's you, I am gonna be with you, because if not, I wouldn't. And I told her, please, I want to be like confident about myself and confident about you, because I know you're a great doctor. And I know that you can solve any problem. And I really want to feel that if there's any problem, you're gonna solve it. And she was the best doula that I have ever had. And she was really knowledgeable about labor and about stages and about everything. So it was, I really had the best time having a labor. We laugh all the time. We had super nice time, and so different from the beginning. And the pediatrician was as well the same. And when my second baby was born, and she put me like a cloth. And my husband tells me that, because I can't even remember now. My husband says that I got a cloth, and I told her like, it's skin to skin. It's not a cloth. And I no. So that kind of things, like I always need to fight for things. It's like beginning in the end. And obviously all my colleagues didn't know anything about breastfeeding, and they didn't support anything. So it was like talking about this that I found really passionate about. And what I thought is that people, they must not know about this. That's why they do not love it like me. They need to know much more. I need to tell them what this is about, so they can really get passionate about this, because it's so amazing. I don't know why they're not looking at that. So I got into the field in this like very difficult moment, but it also happened that in Mexico in 2012, there was this national survey that breastfeeding was very low. After being one of the first UNICEF countries in the world that started in 1991 with a baby friendly, because it was the pilot in the world, and as many things that happens in Mexico, they receive some support. They say, oh, Mexico is doing great, so they don't need much more support now. So they stop giving the support, and it was like a ship that they didn't know where it was going. And that happened in 2012 when they realized that the breastfeeding was really low, like just 14% of babies were breastfed. And then I just became IBCLC in 2011. So I think that moment was like, I feel like things were aligned in the world, because I started to meet people that were talking about that. And I met one of the researchers that did the survey. And she was an amazing woman. So I realized that there were people like me and everyone else that was really passionate about. So one of the conferences in the National Institute where I did my training, she did a talk about breastfeeding and about the national survey 2012. So at the end, I told her, my name is Mariana. I'm very passionate about this topic. I want to know what can I do. I would like to really support in this. I've been trained as an IBCLC and tarara, tarara. She told me, yes, why don't you come this weekend to my house? And I was, what? And then she invited to her house, though, in a very nice place that's called Cuernavaca, that is very close to Mexico, in a beautiful house because, well, she was amazing. Her name is Teresita González de Cosillo, that you might know her because she did a survey and she was a researcher in that moment in Mexico. And then we went to the National University in Mexico. She started to present me to many people that were working in that area. So again, I thought that things were aligned to happen. And then I was talking about breastfeeding. I was talking about this in the media. I was talking about this. And then I always enjoyed in my life like media and social things, but it was like just starting. So it was, again, this situation that happened 2012, 2013, 2014, that we started to make this part of UNICEF. And we did a lot of projects with the National Health Institute in Mexico. And then everyone started to be much more concerned about breastfeeding. And then it became a political issue or topic that it was like really, they wanted to change. And it did. And being an IBCLC was like the only credential that I knew about breastfeeding. So it was like being an IBCLC for me, it was and is like the way to tell people that I know about breastfeeding. That is something that they can come with me because I know that. And we gathered together, and we were 21 IBCLCs in Mexico that I found them like under the rocks, really. I went in 2014 to the first conference, and then it was the first time that we were around 1,500 people in an auditorium. It was in where was it? The first one, very hot weather. I was pregnant of my second child. And then I started to meet people that were talking about breastfeeding. It was the first best conference that I have ever been, even though going to pediatric conferences, not any other conference was as good, so full of oxytocin. And it was like, I'm not as crazy. There are a lot of people in the world that are crazy as me. There are people in the world that are doing things that I do in my own, like with my clients. There are people that are treating other children with this. There are people that believe in moms, that believe in their bodies, that believe in breastfeeding. So it was really empowering. And then we met and we organized the first national organization in Mexico. And again, the alignment of the world, ILCA was starting to do this partnership with other countries. And then we were the first country that had this organization that partnered with ILCA. And things were growing. We started being 21 IBCLCs in Mexico, and now we are 198 IBCLCs in Mexico. A lot of the training, like one of the things that I really enjoyed was teaching other pediatricians, and like teaching and talking about this and let others know about what they can do. I think that was one of the things that I was more interested in. And finally, with everything like ongoing, super good with a clinic in Mexico in breastfeeding, I left. I left everything behind and came to live to London. And it was like one of the super hard because we left for many reasons. Anything really dangerous that happened to us, but it was like for freedom. We left the country because we wanted to be free of many things, for my children to be free. And then what I thought is that I know I'm gonna have the possibility to grow again. Like I can start from zero and grow again. And coming here, it was like super difficult because it was like being no one, like who are you? No, what are you doing? People really didn't care about what I have been doing before, and I started to work as a pediatrician, not as a lactation consultant. And in the field of lactation consultant was just for nurses or just for midwives. Doctors here are not as in the breastfeeding medicine area, which is something I want to change. And but yes, I think that's the worst thing was that, like, feeling that I wasn't anyone here, no one, and starting to build a path again, and starting to do the things that I like to do. And I do work in breastfeeding because the doctor opened me her clinic to work with her, and that has been really good. So I'm working with that, but it's not my main job, which I wish it was. But I think that the good thing about this is that everywhere in the world, we are many crazy people. I think that we want to change a lot of things. I think that we have this like need to get together. I think that we know that being together is the only way to change others. That's my feeling here, and that we need to share knowledge, to share with children, to share with parents, and yeah, never stop thinking, like, trying to meet with what we want. That's what I think that I'm always thinking about, like nonstop about what we really want. And yeah, that's my story. Thank you for listening.